All right, good evening and welcome to this wonderful interactive session. I have a special guest here, Dr. Gaurang Ramesh. So this is going to be an exciting interactive discussion. The session title is an awareness session on gut health and functional medicine. So it looks a little alien to me when we talk about functional medicine. So before we get into the discussions, I would like to introduce Dr. Gaurang. Dr. Gaurang is one of the first functional medicinal practitioners in the city of Bangalore. Being a third generation doctor in his family of surgeons, he was inspired and intrigued by the scalpel. He has completed his MBBS from JSS Medical College and Hospital, Mysuru in 2005, MS General Surgery at Shema, Mangaluru, Fellowship in Surgical Gastroenterology at Bangalore Medical College and Victoria Hospital, Fellow of the Indian Association of Gastrointestinal Endosurgeons. Now, this looks like a very elaborate list of credentials. Hello, doctor. I'm extremely happy to have you on this live chat. My name is Coach K. I'm the founder of KSpit Academy, and also I take pride in calling myself as the global voice ambassador for Alert NGO, and I'm also the Alertathon event director for 2020. It's a very exciting evening. How are you doing, doctor?
Thank you so much, Coach K, for giving me this opportunity to be a part of this international virtual event. But unfortunately, I could not take part in this physically. I could not run or cycle, but I'm glad to be a part of this virtual event. Thank you so much.
Okay. Now, when I came to know about you just a couple of weeks back, and I was certainly our first connection was related to food and the goodness of food, clean food and green food. I saw a post that you've written on LinkedIn, and then we made this connection, and immediately I saw that, okay, fine, I need to be talking to this doctor. He seems to be a very interesting person. So now, when we talk about gastroenterology, it's a little complicated word for me to even talk about. Can you please help all of us who have tuned into this session to understand what exactly gastroenterology is all about, doctor?
So, in brief, gastroenterology is something related to the gut, from the esophagus up to the anus. Everything which helps in your digestion, all the organs come under the field of gastroenterology. But the interesting thing is, in my 10 years of medical education, there was very little training in nutrition I received in the medical school. So I will also tell you about a little bit about integrated gastroenterology and functional medicine here. So when we look at how we have our present medical system, it was a great system when we discovered antibiotics and when we got rid of so many infectious epidemics. We have formed a protocol, the way we look at the disease as in terms of symptoms, and then we have a diagnosis for the symptoms, and then we want to look at how we treat that diagnosis. So this works great in acute medicine. It's a wonderful thing when it comes to treating. If you have a heart attack, our system is excellent. If you have some infection, our medical system is very good for that. But when we come to chronic diseases, it is acquired over a period of 10 to 15 years. So in that kind of a situation, there are multiple factors which are responsible for the disease. But in a typical OPD in a hospital, you spend about 20 minutes with the doctor, and then you are given a particular diagnosis, and everybody with that diagnosis is given the same pill. But that is not working when it comes to chronic diseases. When we want to treat diabetes with increased sugar is a symptom, and we want to treat it with drugs giving less sugar. We want to treat cholesterol, which is a symptom, with a drug which decreases the cholesterol. And there's very little nutrition and lifestyle changes which doctors learn as a part of their training. And the advice you get is very little when it comes to, it's very generalized, and people are also a little confused about what to follow. And everything is in moderation. So when you do something in moderation, you're not seeing a lot of changes. So I got an opportunity to come across functional medicine, which is basically a systems. It's a science. It's a different approach perspective to medicine, where you look at the system for biology and you look at the person as a whole, and you want to really probe into the root cause of the disease and then treat in a personalized approach uh, based on the root cause, based on why the disease is happening.
Okay, so that sounds very interesting. So the functional medicine seems to be the real thing that all the doctors should be ideally be practicing, because you also mentioned about the time duration of any intervention. So when somebody goes to the doctor, they get to spend about 5-10 minutes. The doctor needs to be a superhuman being to really identify the root cause of the problem and also give the correct advice, give the right medication, the course of action. It seems to be a very complex Superman's job. So now I'm going to go one step back. And when we talk about gut, what does that mean, doctor?
The gut is, like I said, it's anything related to all, it's the organs which are responsible for your digestion, assimilation, and absorption. So anything from the time you put your food in, yeah, through which it passes through the esophagus, stomach, intestines, and all the organs which are responsible for the enzyme and digestion, the pancreas, liver, and until the food comes out of your body up to the anus, everything is comes under gastroenterology or the gut.
Okay, now, are you, am I right when I say that right from the mouth to the anus, this is the entire chain of, let's say, from the mouth to where the food exits? Does it constitute the gut, or is it just the internal system which is called as the gut, doctor?
Broadly, it's gut is a layman's term. So it is usually refers to intestines and sometimes the stomach also. But as a layman term, it usually it refers to intestines.
All right. Now, when we talk about the food that is processed by our body, and I think the food it goes through the digestive tract, right from your mouth. So what really happens and what is the function of the gut area? We know that the food digestion happens and the nutrient absorption happens deep inside our stomach. So if you can help me understand, help all of us understand. So how exactly the food digestion happens in just quick words, doctor? That'll be helpful.
Yeah, sure. We usually think the digestion starts only in the stomach, but the digestion actually starts in your mouth. So we have something called salivary amylase, and to a certain extent, salivary lipase also. So which the complex carbohydrate digestion starts in the mouth itself because of the salivary amylase. So when we actually take time to chew about 30 to 40 times in each swallow. This gives enough time and opportunity for optimal function of the salivary amylase. And this not only breaks down the complex carbohydrates, but it also stimulates enough stomach acid and stomach enzymes to be secreted.
I'm going to
So
stop you for a minute. You said 30 to 40 times. Do you think it's really possible? I don't think any of us have time to chew the food that long.
Yeah, that's the compromise we have been doing. It not only compromises our, when it's actually, you can give it a try. When you actually allow your salivary amylase to function, at the end of about 1 minute of your chewing, you'll get sweet taste. So that shows that your complex carbohydrates are broken and your salivary amylase is functioning. So this eases the digestion for the stomach and the intestines also when you take time and really enjoy your food and chew your food. So when it goes to the stomach, there you have uh, hydrochloric acid, which really decreases the pH of your stomach to up to 2 to 3. So that is a real acidic environment which kills all the microbes which you take in with the food from the external environment. And after the stomach, whatever it goes into the intestine is almost like a sterile fluid. So in the intestine, you'll have a lot of enzymes secreted from the intestine and the pancreas and the liver, which helps in the digestion of the food. And the best thing and the most interesting part of intestine, which we have realized now over the past 10 years, is it has its own ecosystem of microbes, which we can call it the good bacteria. So we've always thought that the microbes or parasites are always harmful for the body and our system. But over the last 10 years, there has been so much of research in the human microbiome, which is the bacteria in the gut, that we have realized that about 90% of the genetic material in our body belongs to the microbiome in the intestines. And more than 80% of the cells in our human body belongs to the microbiome of the intestines. So it's not only its function is not just helping us in digestion and metabolism, but it's also playing an important role in the hormones secretion. So there's a lot of research happening in the gut brain axis also, that it has direct action on the mind and the brain. So indirectly, it's responsible for a lot of functions in the body. To just give you a perspective, if you look at the surface area of our intestines, we have something called villi, which is the small projections in the intestine, and microvilli over it. So if you take all the surface area of our intestines and put it on a plain ground, it's equivalent to half of the badminton court. So about 40 square meters of area. So that is how much, that's the kind of opportunity we are giving for the food to interact with our body. And that's the amount, surface area of microbes which can interact with the food. So there's a lot of research and relevance to all kinds of diseases, which we are realizing now, which is responsible by the microbiome.
Okay. Now, you made a very interesting... I'm sorry. Continue. Please continue.
Yeah, after the small intestine, we have the large intestine, where our stools are formed properly, and then it comes out through the anus. So that's the entirety of the gut.
Okay, now that kind of looks like a nice biology class. Probably I slept and dozed off during my school days. But my interest towards the scientific aspect of the digestive mechanism as a fitness enthusiast is always pretty high. In the recent past, I really have kind of soaked myself in knowing more about this, so that I can benefit from this. I'm getting older, and I can also help my clients benefit from the right nutrition choices. Now, you made a very interesting point about sterile fluids. You said that the digestive tract also kills all the microbes which are harmful to our system during the digestive process. And I see a risk in not chewing properly. If I'm not chewing enough, if the mechanical digestion does not happen, then probably I'm increasing the risk of infection by letting these microbes or the microorganism get into my let's say system. Is that a good assumption, doctor?
Yeah, it's only in the initial part. In the stomach, the pH is so low that it creates such a acidic environment that all the microbes are most of it makes sure it's dead. But from the intestine, we have our own ecosystem of bacteria. So then again, you have a lot of microbial flora from the small intestine itself.
Okay. Now, when we talk about the GI or the gastrointestinal system, we often come across GI problem or GI distress. As a ultra marathon runner, somebody who likes endurance sports, the GI distress seems to be a very common problem that I have in the initial stages come across. So I've kind of figured out a way to avoid certain food and certain times of the day, and especially before exercise, during exercise, and after exercise. So now, to help everybody understand what is a GI problem, when we say a GI problem, what does that mean?
So in GI distress can have multiple symptoms. It can be nausea or vomiting. It can be, reflux or heartburn or a sense of regurgitation when you're running, or it can be bloating sensation in your stomach and fullness, and it can be increased flatulence. You're passing a lot of gas, and when you go a step further, it can also cause, diarrhea or constipation.
Okay, now the GI problem can be any of these things that you mentioned. And then what about the cramps that people experience, doctor? So the intestinal cramps, it's called as, is it also a GI distress or is it something different? Is it more of a muscular issue?
There are certain theories for intestinal cramps, but the most prominent accepted concept is that it is from the GI disturbance itself. So anything which cause all these symptoms can also cause intestinal cramps. So we have two linings covering our intra-abdominal organs called the peritoneum, visceral peritoneum and parietal peritoneum. The outer layer is called the parietal peritoneum, and you see intestinal cramps more in running events more than any other endurance sports. And that is probably because there is a lot of to and fro movement in the torso, which is disturbing the parietal peritoneum. And usually it's on the right side when you get cramps. So this parietal peritoneum, when it gets disturbed, it causes this kind of a, catchy kind of a pain. And you have to, the only way you can reduce this parietal peritoneum is by reducing the intensity of your workout, and also by giving it rest, and by breathing, deep breathing. And sometimes stretching on the contralateral side may also help in reducing the cramp.
And is it very similar to the side stitches that most of the absolute beginners experience when they start running? They are doing a little surge or running at a little higher intensity. I have experienced side stitches during the earlier years of my running back in 2011, but I don't experience that anymore. Is it just that my body got used to that, or what has happened to me? Why am I not experiencing side stitches?
Yeah, to go into the root cause of side stitches, that irritation is probably because of there are several reasons. Now, one thing is, why is your GI getting distressed? Is first thing is compromise in the blood supply to your GI system. So your body has its own wonderful mechanism of maintaining homeostasis. So our important organs always get first preference of blood supply, which is brain, heart, kidneys, and the main organs. And the second preference is given to the peripheral system, like your hands and legs and your GI. But when you're doing endurance sport, all your blood goes into your musculoskeletal system, your hands and legs and your muscles. So there is slight compromise in the blood supply of the gut, which the body cannot, maintain, compromise, and it takes time to get used to it. So in the beginners, you see more of side stitches than in experienced runners.
Okay, so
and the second thing is when you have, and there are some more reasons for that. when your gut is unnecessarily over distended. This can happen when you have consumed concentrated drink. For example, when the concentration of carbohydrates in your energy drink or your sports drink is more than 10% of its weight, then it becomes hypertonic for the intestinal tissue. So you can imagine the intestinal tissue like a semi-permeable membrane. So when you put in a solution where the osmolality is higher than the blood osmolality, then instead of your fluid getting absorbed, more fluid is secreted into your intestinal lumen. So that gets a little distended.
And can
And
it
the
cause
second thing is,
dehydration? Can it cause dehydration?
yeah, that can also cause dehydration, and it can also cause nausea, and sometimes when you it can also cause regurgitation also.
Now, just
So
wanted to highlight this. I have seen this as a most common problem in endurance athletes, and especially those who are trying a new gel on the day of a marathon, or the electrolyte is supplied in abundance in all the aid stations. They're not used to this, and then while running, they consume because they were told that okay, electrolytes are important, and then you can see that after running for about if it's a full marathon, maybe about 3 to 4 hours time period, that's when the stomach cramps and whatever you described in terms of the nausea or even vomiting kind of a sensation for multiple times. They struggle a lot because the GI system is under this stress, big time stress. I've witnessed this in many times during a running event.
yeah, the well, some more things beginners tend to make mistakes is like I mentioned, the hypertonic things when you overconsume the gel or when you take a lot of fluid. But also when you're not concentrating on the kind of nutrient constituents of your pre-workout, during the workout, and post-workout. Even a meal with high protein and high fat anywhere at least 1 to 4 hours before the sport can also cause delayed gastric emptying. It slows down the amount of time it takes to move from the stomach to the intestine. First of all, it will take time for you to give enough energy. So it's not converted to energy, and it's causing a little bit of GI disturbance. So that can in turn cause all these symptoms again, like your cramps and reflux and nausea.
Now, a large number of audience who would be interested in this session or may not be into endurance sports and running. And I just saw that there was a question from Smitha, and she wanted to know how to maintain healthy gut naturally.
Okay. This is a quite a deep topic on its own. So I'll just tell few highlight. Well, I'll highlight the important points. So to put it in plain simple words, we have to have real food. So what we usually have in is all what is real food is what grows naturally in plants, which is not processed and which is not there's a quote: you eat food grown in on plants and not grown in plants, like made in factories. So uh, when you eat real food, you get a mix of everything. There's a lot of calorie in, calorie out concept going on around, and you translate that only in terms of the macronutrients. And everywhere you eat processed food, looking at the labels, and you're not really concentrating on the enzymes and the micronutrient aspects of it. So when you eat real food, whole plants, you get phytonutrients, you get antioxidants, you get micronutrients, vitamins, everything in the right proportion, and that plays a huge role. The next thing is you have a combination. You hydrate yourself enough, about 8 to 12 glasses of water. But But another mistake what we do while hydrating is we tend to eat a lot of juice items. In juice, we get a lot of empty calories and we don't have enough fiber, or sometimes we miss out on micronutrients also. So we only get carbs, mainly carbs from that, especially the processed juices. So water is the best form of hydrating ourselves. And the other aspects to look at our gut function, whether we are having a healthy gut or not, is to look at our symptoms. Like I told you, you should not have bloating and fullness and all that. And also look at your stool consistency. That is a great sign of having a good GI function. Your stool, you can Google something called the Bristol's stool chart, BRISTOL stool chart. So your consistency should be in the middle. It should not be too hard or too watery also.
Okay, now how to maintain healthy gut naturally? Natural food, water for hydration, not juices, with a high concentration of sugar. Stool consistency, that's something that I have learned very new terminology, including this Bristol stool chart that you mentioned, because I always I'm familiar with the urine color to check the status of hydration. But this is the first time learning something like this. That. Thank you so much for introducing me to this concept. So now, going back to the GI distress. Now, for somebody who's not into endurance sports, and we are talking about a middle-aged woman or a man, this GI distress doesn't have any connection with specific sex, men versus women. Who experiences more GI stresses, and if let us say one sex experiences this more, what are the reasons, doctor?
When you look at all the health problems in general, women tend to live longer. They tend to get lesser chronic diseases. But when you talk about GI problems in athletes, it's the opposite. Except for reflux. Reflux is what men get more often. The other problems, a lot of carbon dioxide produced because it gets neutralized by your stomach acid. So this carbon dioxide can be more when you have carbonated drinks, or when you add some amount of baking soda into your energy drinks. So that time you might have more of carbon dioxide. This can also be a little physiological. But what is problematic is when it is produced, this excessive gas is produced by bacteria. Even this can be normal when you have a lot of fiber, legumes, or a lot of fiber content in your diet the previous day, and some sprouts, and some vegetables. Some people tend to produce more gas because there are certain complex carbohydrates and fibers which our body is not optimally designed to absorb into our system. So these complex carbohydrates are fermented by the intestinal bacteria, and in the process of fermentation you produce gas. So this is predominantly methane and carbon dioxide. But when you are producing sulfur containing gas, that can be foul smelling, and sometimes that can be because of the bad bacteria. So what you can do is you will have to look at your diet. So if your fructose content is producing, then you'll have to cut down on that. So it helps when you have a food diary. And definitely you have to cut down on carbonated drinks. And another reason for, because one of the main problem here in endurance sport is you go into a inflammatory state. There is a lot of stress generated in an endurance sport. So you have secretion of catecholamines from the adrenal gland. So these catecholamines are responsible for many of the problems like nausea, anxiety, IBS, and all that. So as you age, your system is more resistant to this catecholamine response. So younger people tend to get GI problems in endurance sports more than the elder population. And like just like your training, your body also gets acclimatized. So people who are less trained get more GI problems than the trained athletes.
Okay, now one of the most common problems that most people experience is the stomach bloating, and of course, flatulence. I don't know if it always is paired. When you have bloated stomach, you also get more flatulence. Now, while it's a funny subject to discuss, but I feel this is very important for us to learn what.
And your body is not able to completely digest it, you will get bloating and other food sensitivity symptoms, which can also cause uh, brain fog. You're not able to think clearly. It can also cause migraines. So cutting down on milk will help you reduce your flatulence also.
Okay, now there is this is the food is of course is a very complex topic, and we are talking about extreme dieting and different kind of dieting mechanisms, uh, veganism, and LCFH and keto. So these are kind of different theories, different philosophies, different principles. Now, how do I know what is out of all this long list of food that might cause problems, like milk or gluten content? We also say that consuming egg also increases the sulfur content, and the flatulence is a problem that we talked about. Where do we stop this madness, doctor? I don't think during our, let's say, yesteryears, our parents worried so much about all these problems. We are now bombarded with a lot of theories about uh, the food and then medication and complexities involved in that. So where do we draw the line? And I'm very confused because I don't know whether to have milk or not. I don't know whether to have wheat and maida or not. This topic needs some simple explanation, but I know that this is a very complex topic, and I'm not going to put you under stress. But appreciate if you could give some guidance to all our audiences in terms of what food to choose and what not to choose. How do we know that I'm intolerant to a particular food?
Yeah, I definitely agree. Like you said, it's become very complex with a lot of controversies when people are fighting against and for. And but the simplest way to look at it is looking at your ancestral history. So there are research which for and against keto, for and against paleo, for and against carnivore diet, and vegan also. But the simplest way is when you have some GI problem, it's best to go for whole plant-based diet. That is the simplest on your gut. It is the easiest to digest. At least until you recover, it's best to go on a whole plant-based diet. Once you recover, when you are training, when you need a lot of protein, then your intake depends on, you can go into your ancestral history. When you have many of your generations who have not consumed non-vegetarian food, and now you start consuming non-vegetarian food, your microbiome will take time to adapt for the change. So it's, and there are certain meats which can be easily accepted by your gut, and there are certain things which can cause a bit of allergic reactions and sensitivity issues. So it's easiest way is to look at your ancestral history, and after you recover, you start consuming. And when you come to milk, there is enough evidence to say that it's not a very important requirement once you're an adult, because when you look at autoimmune diseases, when you stop milk, about 40% of them start improving. So there is evidence supporting milk that we have enough enzymes and to digest lactose, and we can easily uh, assimilate it without any problem. But when you look at the other way, when you stop milk and what are the changes the person has, that is more convincing, because many of when you stop wheat and milk in all the autoimmune, about 40 to 50% of them, their symptoms start reducing, like psoriasis, migraine, and arthritis, such symptoms. So I am a little against milk for adults. For definitely for children and adolescents, their growing age, and to a certain extent, athletes also can have. But when you're a normal functioning adult, I think you can give up on milk.
Okay. And what about gluten?
Gluten is again uh, slightly controversial because when you have certain genetic diseases like celiac disease, you're very clear that you should not take gluten. You have to give up on gluten. But when you have something called non-celiac gluten intolerance, that is to a certain degree you have developed sensitivity. You develop certain antibodies like IgG antibodies against gluten. So those people will tend to have a lot of improvement when you stop gluten. But again, it is not in the entire population. Some population tend to, easily digest gluten and be okay with it. The best way to know and the cheapest way to know if you have to stop gluten or not is to eliminate gluten for 3 weeks. After 3 weeks, you see symptoms. It doesn't have to be just GI symptoms reducing. You may experience your skin rashes reducing. You may experience headaches reducing. You may experience, better mental clarity. So when you're able to experience such symptoms, then you're sure that you have to stop on gluten. If it's not making a difference, then you can go ahead and have gluten.
What are the normal problems or symptoms that one will have to go through? Let's say if you are talking about living milk and gluten at little older ages, uh, what kind of impact does it have on the body? Does it mean that I have a reduced chance of heart-related ailments, or is it directly a GI-related benefits that we are talking about here? Because we also talk about the fat in the gluten and also the let's say these simple carbohydrate, which also has a physiological issues with insulin production and those kind of things. It also affects the overall health. Now, when somebody eliminates gluten and milk, so what is the positive change that they will experience? You said 3 weeks. Is 3 weeks? Will somebody notice something dramatically?
When you are I'll just tell you in brief about food sensitivity. It's a fairly new concept which was not there. A lot of it was not there in our medical textbooks. So this food sensitivity is when there is certain aspects in the food which stimulates your gut to become more permeable. Like there is certain size of particles which can pass through your intestinal mucosal cells into your bloodstream. But over time, when there is some trigger, when there is some stimuli constantly creating inflammation in your gut mucosa, it starts becoming permeable to larger molecules. So when you're taking in amino acids which are not completely broken down, when you're taking in complex carbs which are not completely broken down, and sometimes it can be toxins also which is not assimilated. So when that gets into your bloodstream, it can cause something called as molecular mimicry. It can mimic a toxic substance, and it can trigger an inflammatory response to your body. You start secreting IgG antibodies. So this can not only, and by the way, our gut has 2/3 of other immune cells in our body. In the entire body, 2/3 of the immune cells are in the gut itself. So when you start secreting these antibodies, you start seeing symptoms all over the body. It can be migraine. It can cause skin rashes. It can cause lupus. It can cause psoriasis, or it can cause joint problems and arthritis. So that is the kind of impact food sensitivity issues can have, which we are now realizing. And even to test you if you have food sensitivity, the kind of tests are not completely developed, especially in India. It's very difficult to find labs doing food sensitivity. So that's the reason I said the best way is to go on an elimination diet. And within 3 weeks, if this particular food item is causing problem to you, you'll definitely know the difference.
Okay. And is functional medicine the answer for finding the food sensitivity?
Yeah, the reason functional medicine it goes a lot deeper into your see a typical functional medicine consultation first time will take about 1 to 1.5 hours. So in this aspect, in this kind of perspective, you really go into the root cause of the disease. You talk about from the time you were born until now, all the toxins you were exposed to, the kind of history, all the kind of relevant medical history you had is discussed. So a lot of information you can get when you go into so much of detail into your history. And functional medicine has been very open in adopting the newer diagnostic techniques like going into the food sensitivity and looking at your antibodies, or going into the DNA of your microbiome and assessing, we call it dysbiosis, when there's something wrong in your interaction between your microbiome and your body, looking at dysbiosis, and also looking at the metabolic compounds in your urine. So all these diagnostic tests have been adopted by functional medicine, and it's not yet completely adopted in the conventional medicine.
Okay. Now, I've got a favorite question most of the runners would like to know the answer for. Um, Now, if you see most of the running events or long distance endurance runs or even marathons, one of the most favorite topic is carb loading. Okay, so the carb loading is usually done by, let's say if it's an ultra marathon, 5 to 6 days before you go on a low carb diet, you kind of deplete the carbohydrate and glycogen store. So then, kind of after a few days, just 2 days before the event, you start loading your system with a lot of carbohydrates. Now, can you help me understand what exactly happens when somebody is carb loading, and then uh, how it definitely helps in improving the glycogen store, which also has a direct impact on overall performance on the event day? Now, a follow-up question on that is, what happens when a fibrous food is taken? This is generally a recommendation not to eat fibrous food. I'd like to know what really happens. And then the last part of this question is, after the run, the post run, everybody likes to go for a big celebratory large meal. And those who likes Hyderabad run and also the Hyderabadi biryani, they love to basically go and have it. Is that something that you would recommend or not?
Yeah. Now I'll start with the initial part of the question. So when there's a lot of athletes going into keto diet and ketosis. So before that, to explain about the glycogen, the easiest form of energy your muscles and your cells get is by carbohydrates. So if you are getting energy from the fat, which has to be converted into carbs, it takes more effort and time. So, but when you're in ketosis, it's a different phenomenon. Ketones will also give you ATP. It is also a separate phenomenon, but your body has to get adapted to ketosis. So when you are in ketosis, when you're in low carb, high fat diet for a long period of time, your body, there is something called sodium glucose co-transport receptors in your gut, which are responsible to absorb carbohydrates. So those receptors also will tend to reduce. So when you are in ketosis for a long time, and then on the race day, you're running and you tend to you do carb loading, your body will not immediately be able to make use of all the carbohydrates. The amount of effort your body needs to absorb the carbohydrates and utilize it is much more inefficient when you're in ketosis. So it's best when you're in ketosis, at least 1 week or 2 weeks before your race day, you start having carbs. Otherwise, it's called SGLT receptors is not acclimatized to carbohydrates, absorbing carbohydrates. That is one thing. Second is I think you wanted to know about post workout, large meal.
No, the carb
So
loading, what
what
really
happens?
happens? So the one part of the first part of the question was all about depleting the carbohydrate, the glycogen store 2 3 days before the. Let's say if my race is on Sunday, the first 3 days in a week, I'm going to go on a complete depletion of carbohydrate, and then go for a long LSDs or the slow distance runs, and basically running with the low level of carbohydrate stored, the glycogen depleted state. And then when the glycogen store is very, very less, and then the runners would generally pick up more carbohydrates, high, let's say complex carb diet for 2 3 days before the race and 1 day before the race. So there's a lot of carbohydrate is loaded, and this is believed to increase the glycogen storage, which is going to help you with the stored energy. And somebody can run a 2 hours half marathon without having any additional fuel. So this is the carb loading mechanism followed by most of the ultra runners. So now when the carb loading happens, what really happens in the system? How does it really help a runner to get that extra stored energy in that 2 days time period?
Yeah, so the easiest, like I said, the best way for you to get energy is by carbohydrates. And the way carbohydrates is stored in your liver and to a certain extent in your muscles is by glycogen. So when you carb load, most of it is converted to glycogen and stored in liver and muscles. And on your race day, you start breaking down the glycogen and you start utilizing the carbohydrates. But like I said, what happens if you really want to prevent GI symptoms, GI distress, then you have to train your gut also, like you train your muscles, to assimilate the kind of complex carbohydrates you're taking on the race day. So, being on ketosis when you're training, 2 3 days you load yourself with carbs, and then on the race day again you try to drink energy drinks and complex carbohydrates. Your intestinal system is not, programmed to suddenly take in so much of carbs. Like I said, your receptor count itself would have decreased because you're on ketosis. So when you plan to, if you want to stay on ketosis, if you're trained enough in ketosis, then you continue to, on your race day to be on ketosis. But if you want to give your best performance, you don't want to compromise, you don't want to take risk, then at least 2 weeks, you start taking some carbohydrates into your system so that your body is trained to, on the race day, your body is trained to absorb and use the carbohydrates.
Okay, and the post-run reload, what's your opinion on that? Once the endurance
Yeah,
run is
that is
done.
one of the reasons you get GI's symptoms. You wait for about 4 hours. Uh, See, especially in endurance, the amount of blood supply to your gut really reduces. There have been studies which has compared the kind of VO2 max in comparison to your gut blood flow. So there, it's proven that endurance sports will reduce the amount of blood supply you're getting to your gut. So
It's
it
about
takes
2%.
about three
It's
to
about 2% blood supply.
we can't be sure on the number, but when you increase your VO2 max, the portal vein blood flow has shown to reduce. So you have to wait for about 3 to 4 hours post exercise for a huge meal, like for a feast meal. Before 4 hours, if you start having a feast, then again you start developing GI symptoms.
Okay, now this certainly is a very complex topic, and the packaging all these interesting questions and trying to find answers, very simplified answers by itself is a complex process. And I'm really happy that you found time to spend and kind of answer these questions. I can confidently say that I felt like going back to my college days, asking a lot of questions to the science professor and getting a very structured and a very patient answers. And you seem to have a lot of patience, and I'm certainly happy that I found you to kind of help this session and the kind of questions that we have been getting from people. Now, one last question: are you into running? Are you consider now? We didn't talk much about you due to the nature of this session and also the time. Are you into sports? Are you into running?
Yeah, I have been a little bit into running. I've gone up to 15 kilometers and 80 kilometers in cycling, but I've not been able to go beyond that because I'm not able to spend enough time in training. So
Okay.
it's always been a casual run and
Well, it
exercise.
must be a stressful time for all the medical community during the pandemic, and I'm sure your service to the community is highly respected, doctor. So now, one last question from my side. Um, Now, we talked about all this food-related stresses affecting the GI system. What about the stress that people go through? Now, the pandemic is very stressful. Sitting at home is very stressful, and complex problems that people deal with also can put a lot of stress in the system. Does stress have any correlation with GI distress?
It's good that you brought about this because it's one of the major causes for so many GI problems. Like I said, a lot of these symptoms are because of excessive catecholamine release, that is adrenaline and noradrenaline release. So that is predominantly due to stress. So it's not just the physical activity which is causing stress, but also the anxiety in a competition when you're doing an endurance sport, and also the other factors like mental stress and the pressure the athletes have. So this plays, in fact, more important role than the local gut factors. So I would suggest stress reducing advice for all GI problems: doing deep breathing exercises, doing abdominal breathing exercises. The best way is uh, the magic of abdominal breathing is when you focus on your abdominal breathing, abdominal movement while breathing, it really stimulates your parasympathetic system, which is opposite to the stress sympathetic system. So it stimulates your diaphragmatic nerves, the vagus nerve, and it reduces the stress to a great extent. So deep breathing exercises, meditation, and abdominal breathing is definitely recommended for all kinds of GI problems.
Okay, beautiful. I would like to quickly summarize my learnings, my takeaway from this session. So you mentioned about the whole plant-based diets. It's a best thing to go for. And of course, breathing. We talked about breathing. You just highlighted as the last point. Of course, talking, uh, not swallowing the air while eating. So the swallowing the air kind of leads to flatulence. And you also highlighted the importance of chewing at least 35 to 40 times. Enjoy the food, enjoy the sweetness of the food, not to be in a hurry. And of course, milk is not a recommend if you're an adult, and try to eliminate gluten. And if you have any GI distress, always go for this elimination process to understand. And then train the gut, assimilate the carbohydrate. If you're a marathon runner, make sure that you are training with the right combination of food during the training days, not just going and doing an experiment one day before the race. And then, of course, your answer to how to maintain the gut health is going for the natural food, water as hydration, check the stool consistency, look for the Bristol stool chart. So these are some very interesting learning, and I'm sure this session can go much longer than this. Plus, my scientific understanding of digestion is also very minimal, but I try to have this session primarily to help a large community of people who may be interested in these questions. And then especially packaging this during this 5 days ceremonies of the Alertathon event. As you probably know, Alert NGO organizes Alertathon. It's more of an awareness event to save lives by learning first aid and CPR. Now, if you really see, first aid is basically a technique or a skill to, in case of an emergency, you react. But now, whatever topics that we discussed today, there are also a large number of opportunity for us to prevent those issues. And those prevention can happen with embracing a simple lifestyle, a stress-free lifestyle. And then one last thing I would like to mention is I really liked what you said about the food grown on plants and not in plants. Now, I'm going to really cherish those words. This is really an important phrase that I'm going to walk away with this little session that we are having. Thank you so much, Dr. Gowran. And it is my absolute pleasure to have you today. On behalf of Alert, the entire Alertathon team, I would like to thank you and also wish you good luck for your future career and also all the aspiration that you have in your life. Thank you so much.
Thank you so much, Coach K, for giving me this wonderful opportunity in this event. And it was a very comprehensive and a concise way. And as you said, it's a very huge topic which can go on for a long time and in a great detail. But thank you so much for this wonderful discussion.
Thank you so much. Have a wonderful day.